About 10% of pregnant women and 13% of women who have just given birth experience a mental disorder, like depression or anxiety, according to the World Health Organization. Stay-at-home orders and the COVID-19 pandemic may be adding to this, making moms feel isolated. But we can help moms and babies thrive. Hello everyone, I'm Susie Lowry Hall and I'm Enloe's Community Outreach Coordinator, and I'm joined today with Holly Kralj, a certified nurse midwife with Enloe's Women's Services, to talk about this topic. But before we get started, please remember the information we're about to share is not intended to be medical advice. If you have specific questions about your mental or physical well-being or the health of your loved one, please talk to your provider. And as always, feel free to post your questions in the comments field, and we'll do our best to answer as many as possible during the broadcast. And with that, we're going to go ahead and get started. So thank you, Holly, for being here. As I mentioned in my intro earlier, many moms are experiencing the prenatal mood and anxiety disorder. Can you tell us more about that?
So perinatal mood and anxiety disorders, we call it PMAD for short. It can run the gamut from mild depression. We see a lot of anxiety. There are multiple different types of issues that come up. It's just important for women to know that they exist. You know, we say about 1 in 7 women will experience a PMAD or perinatal mood and anxiety disorder, and postpartum depression is the one that has gotten the most press, but there's lots of other different issues out there for women.
Okay, are there more women who are more at risk of these disorders?
Sometimes we don't talk about how hard the postpartum period is or how hard pregnancy is, and so we talk about all the fun things, but we don't talk about the fact that your body is going through huge changes, hormones can be all over the place, and it's stressful to be pregnant in the current COVID issues. It's stressful anyway, and then I'm seeing lots of women with really increased anxiety for sure. Mm-hmm. Women who are more at risk for perinatal mood and anxiety disorders, certainly women who have a history of depression or anxiety, because that's not going to magically go away, right? Pregnancy, though it's this kind of happy time, sometimes it's not that happy. So those women are more at risk. Women who are socially isolated or have a baby that has issues. So mamas who have a baby in the NICU, these are moms we really need to be paying extra attention to and shoring up and supporting. In terms of other risk factors, family history. So if we have family history of depression, anxiety, that can increase a woman's risk.
Yeah, that's great. And I really appreciate the fact that you kind of identified the fact already that there is lots of joy that comes with being pregnant and postpartum, but there's also there's sometimes less joy in other parts of it as well.
I'm part of the Mothers Strong Collaborative, and that's a group in Butte County that has really worked to increase our resources for mamas. But one of the things that they say is, what if the happiest time in your life isn't, Mm-hmm. And then I'll tell you that makes women feel really bad, because here they really wanted this baby, and they're, everyone's celebrating and they're struggling.
Yeah, it's confusing.
It's confusing, and it can make them feel guilty for having those feelings when they're just feelings. They're normal.
Yes, you are not alone. It is very normal. I would agree. At least I can relate to that for sure. Yeah. So how are these conditions, we talked a little bit, but can you tell more about how these conditions affect their moms and the babies, and then how can they affect the rest of the family?
So postpartum depression, moms usually they can feel any number of ways, but usually really like fatigued and overwhelmed and all of, unable to cope, unable to stay on top of things. Now, when I say that, does that sound like all of us? Yes, right? Or, what mom doesn't feel fatigued and overwhelmed? And so just to understand that there's this whole continuum, right, of baby blues being on the real mild side. 80% of women are going to have baby blues in that first 2 weeks, where they're going to be tearful and, feel overwhelmed. However, women should be feeling more like themselves by the end of that 2-week period. And so if they're not, then we start to wonder if there's something else going on. And there can be things biochemically going on, things in the brain. There can just be stressors. There are a multitude of different reasons that women can have postpartum depression or perinatal mood and anxiety disorders. So there's also, and I said depressed mood, but sometimes it looks like anger. Sometimes it feels like, like crawling out of your skin, frustrated, angry. And that can be scary for women. Don't really like to feel angry in our society. That's kind of something that we don't play with as much. Anxiety, so postpartum anxiety and PTSD. Some women have either like memories of the birth or fears, different things that kind of come to them afterwards. Women can have sleeplessness, intrusive thoughts. And intrusive thoughts are about 30% of women in the postpartum period will have intrusive thoughts, and that's something that we don't talk about so much. And intrusive thoughts are like where you maybe have something, you see something, or you're worried about your baby. Who hasn't gone and checked to make sure the baby's sleeping or
gotcha.
breathing, right?
Right, where you like
you worry.
You lay down, you're like, and you walk. Yeah, you get back up.
Or some women have other intrusive thoughts that are scary to them, scary thoughts, but it's not really from them. It's just kind of happening, and those usually will go away. But again, that can be postpartum OCD. So there are women who have, and all of these things are things that can be diagnosed and treated. That's the important thing, is that people know that this happens, so that they can get help with that.
So again, these things sound very overwhelming for women and these new moms. So how does that affect, are there effects to the family and the babies if mom is kind of in this state of mind?
Absolutely.
Okay, can we share on that?
And my bias and my lens is moms, because I'm a midwife, so I'm all about the mamas. But remember, the mama's the queen bee, and the hive cannot survive without the queen being healthy, right? So picture this postpartum period, and what we have expectations of women doing is unreasonable in the postpartum period, frankly. And so women come home with this new baby, maybe they have a toddler at home, and they're trying to breastfeed, and they're maybe struggling with that. When mom is not feeling well, that's going to have, we know there are impacts on baby. There are documented impacts on baby. We know that there are impacts on the family. We know dads can actually have postpartum depression, and partners, because there are families that don't have dads that have, same-sex partners, or I don't want to call it just one particular thing, because our families look many different ways. But families will feel the stress, and people can feel really powerless. If your partner is struggling and you don't know what to do, that can be really hard on a family system.
Yeah, absolutely. And I wonder if on the flip side of that too, and I think we'll have a question about it, but then like sometimes women don't always know how to ask for what they need, which I know is also kind of a tricky piece in that relationship.
Sure. And so when you go into, we could do marriage coffee clatch, but
next time on our next
session. But so there can be dynamics within a partnership and within a relationship where it's just makes everyone feel more isolated, right? Because if you're not feeling like you know how to ask for what you need, and if your partner's feeling like they don't know how to help you, I have seen people where there are postpartum struggles and the couple just really leans into each other, and that can be wonderful, if that woman can feel supported by her partner and they can come together. But we know how hard that is. We know how, as humans, how hard that is to meet other people where they need us. And so that can certainly be a struggle on a marriage or on a relationship or on a family.
Absolutely. So you mentioned these a little bit, but I want to go ahead and reiterate the signs, some common signs that moms should be aware of, and then also maybe our loved ones, going back to this dynamic of how we can support each other and recognizing what's the difference between some baby blues, which are rarely really common, and if it's going to move, if maybe it's more than that.
And so I guess the first thing that I would say is it's really important for women in the postpartum period to have their people around them creating kind of a protective place for her, right? Because she is so vulnerable, and it is just an emotional time. Anyone who's had a baby, Yeah. And so women sometimes can't really see what's going on within themselves. Like you're saying, it might be that other people saying, honey, you seem like you're not quite yourself. Women who are, again, some women, like, they just show up all put together, right? But they're not sleeping. I'd say that's one of the big things I would ask is if a woman's sleeping, if someone's not sleeping, we need to check into that. And I'm not talking about the not sleeping because the baby's waking you up, but ruminating thoughts, just anxious, up all night kind of thing. That's something that we really need to follow up on. And again, we now are screening women, and I'm so pleased. Enloe's been so good about embracing the importance of screening, because we know that mood and anxiety disorders are more common in pregnancy than gestational diabetes. Okay? And everyone knows about gestational diabetes, and every woman gets screened. We have treatments for mood and anxiety disorders in pregnancy and postpartum. It's diagnosable, it's treatable, women do great, families do great, babies do great. But again, if we're not paying attention and we're not screening people, then women are sitting out there in isolation, not knowing that this is common, that this is something that happens, and that there are treatments, and that, you know, they're going to be okay. It's not their fault, and that we're going to make it through this. Again, if it's in that first 2 weeks, it's probably baby blues. But if it's in that first 2 weeks or in that first 24, 48 hours, and a woman is really distressed, please don't ignore that. I mean, that's something, postpartum psychosis is something that sounds so scary, and I mention it because it's so exceedingly rare. It's you know, exceedingly rare that a woman has postpartum psychosis. That's mostly in a woman who either has a history, diagnosed or undiagnosed, of bipolar disorder, and it usually happens pretty rapidly after birth, but that's a medical emergency. So if someone has someone that is in their world that does not seem in touch with reality, that's a 911. That's a let's get some help for this family.
That's great.
Okay, but that's not the norm.
Right.
And so sometimes we don't talk about perinatal mood and anxiety disorders because what people associate with that is that really scary thing. And that's not the norm. The norm is women feeling really overwhelmed and struggling and anxious and not feeling good about themselves.
Wow, thank you. That was great. So now we're going to talk about the current pandemic.
Yes.
And so how is this affecting moms, and why is that?
So, COVID-19, it's this brave new world, and we are all struggling. And I have seen it in my friends and family. I've seen it in my patients. I just got back from a virtual conference on Zoom. Yeah. Just had a big conference, an international conference on perinatal mood and anxiety disorders, Postpartum Support International. But I'm hearing all across the country, everyone is struggling, right? And so now you have a mom. Imagine that you're pregnant and you're anxious anyway, right? Because Mother Nature gives us these hormones to make us a little bit more on edge, so that if back in the old days a mastodon came, we could pick up the baby and run, right? But sometimes that's not helpful to us because we have enough anxiety going on and we don't have mastodons chasing us. We just have this global COVID-19, what is it out there, right? So women are anxious. Women are worried about how it's going to impact their baby. Women are worried about, when I go to give birth, what's that look like in the hospital? Am I going to be able to have my support person there? Which the answer is yes. But yeah, there's all these unknowns. And then in the postpartum period, where really what we need is social support. Really, we need people connecting, and that's one of the things that's protective for women is social support, having people around and other moms to talk to. We're all sitting at home isolated. So imagine what that's like for this new mama, and maybe grandma and grandpa can't come and stay because they're worried about the little one passing on COVID. Or it certainly has taken what is a common thing and exacerbated it, made it so much worse.
Yeah. So I have two follow-up questions for you. One is, I'd love if you could share more. You mentioned that if you could talk a little about what Enloe, if a mom is expecting, maybe share a little about what they can expect when they come to Enloe. Maybe I'll stop there and then I'll ask my follow-up question.
Okay.
But yeah, maybe share it since you touched on it a bit.
Yeah, so what I want to say is that we really have women's back. We are doing everything that we can to keep women safe, to keep babies safe, to keep families safe. You know, all of the OB staff and pediatric staff are working hard and advocating to make sure that we have everything in place for women to be safe physically and emotionally. So yes, women get to have their partner with them at birth. Currently, the recommendation is that the partner can be there and stay, and that they're allowing right now one other support person per 24-hour period to decrease the amount of visits. That could change. We just don't know, right?
Mm-hmm.
But everything is in place in terms of hand hygiene and protection to make sure that people are well. With another thing Enloe has done is, because we cannot have our normal childbirth classes, everything has been put online. So if you go to the Mother Baby webpage on Enloe, there's tons of fabulous resources. I really encourage women and families to go there and to get their education and get all that they can leading into the birth experience. But that doesn't, everything online is not the same as having human connection. So again, I just think it's really important, whether it is your close bubble of people or whether it is online support groups, there are ways for women to connect. And I really think that that is something that's helpful for women in pregnancy and in the postpartum period, especially in this pandemic.
So that's the perfect response. I have my next follow-up question. I'm sure everyone's wants to know too is, so what are the resources available? So you mentioned Enloe's website.
Enloe's website has tons of great resources. I always refer people to the Mother's Strong if you just type in Mother's Strong. Or I don't know if people know about Butte 211. You just type in 211 and you call it. And there is a person that helps you navigate what's available in terms of resources in our community. There's a huge website, First Five, which has funded a number of these different programs that help people navigate resources out there. We have a new thing called Help Me Grow, and so that is more for the pediatric population, but that's another amazing resource if you just Google Help Me Grow, to help get people plugged in with different kinds of resources. I want to mention Postpartum Support International. Postpartum Support International has a website and has online support groups. They also have resources for families, resources for fathers, all sorts of different information, resources for professionals. And at Enloe, if anyone is ever having any questions or concerns, call the provider, call the OB department. We are well aware of issues that women and families face, and we have programs and resources in place, and we will walk people through and help them get the help that they need.
So great. Thank you. Okay, so now my questions are, so what are the things that women can do to help with their mental health during pregnancy and postpartum? What are some things they can do?
Okay, and so there are tons of things that women can do to help themselves stay strong and healthy.
Okay.
I also want to throw out that when depression and anxiety or other mood and anxiety disorders happen, it is not the woman's fault. Because sometimes I feel like we have so much pressure on ourselves, And so it's like, but I did everything right. I did this, this, and this, and it still happened. What did I do wrong? That's not the case at all. With that said, what we know in terms of things that are protective, we know that social support is important, okay? So finding those systems of support. We know that women who don't get enough sleep, particularly in the postpartum period, are at high risk for depression and anxiety and other kinds of issues. Now that sounds impossible, right? Because babies wake you up every 2 hours. That's their job. But for a woman who's really suffering, that is something that I clinically would say, and the experts would say, is 4 to 6 hours is not optional. She has got to get some sleep. And we'll talk about breastfeeding. Breastfeeding, I'm a lactation consultant. It's huge, it's important, it's wonderful. But breastfeeding and sleep don't have to be mutually exclusive. If a woman is really suffering, I would recommend that she get that 4 to 6 hours of sleep, and that's supported in the literature and by multiple experts. Pump,
Yes.
Or wake up, feed the baby, go right back to sleep. But we've got to get some uninterrupted sleep.
Yes, I would absolutely agree with that.
Women also, in terms of things that are helpful, good nutrition, protein in particular. So every 2 hours, I would recommend women get some protein on board. Whole foods, there's lots of studies that show refined sugars and food coloring, those kinds of things are not great for mental health. There's lots of interesting studies out there around the gut health, so probiotics may be useful for women in terms of staying healthy and strong. And then exercise. Exercise is protective and helpful in terms of depression and anxiety. Hard to do though, right? Because if you're depressed or anxious, so again, I don't want women to feel guilty about where they are or what they're doing, but there are things that we can do that will help our bodies and help our brains. Depression and anxiety are disorders of the brain. It's a brain illness, just like diabetes is a pancreas illness or a bladder infection is a bladder illness, right? And so there are things we can do that support the brain to heal.
We'd like to invite you to join us for our first ever virtual Mother Stroll event. For anyone who's ever participated in the past, this event typically has always been at a park, and we gather together and we go for a walk and we do a resource fair. But again, giving the, we're shifting and we're reframing the event so that we can still support each other through fitness. So if you would like to join us, it is, you don't have to do a walk. You can do any type of fitness that you connect with, which is the whole concept now is just about being active and doing something for 30 minutes. You can sign up and register at runsignup.com. You can call a friend. You can make virtual appointments with a friend and go walking or swimming or a bike ride, whatever you want to do for 30 minutes to get yourself a neck gaiter and also some resources sent to their home as part of their packet.
That's great, because I don't know that you'd have to live under a rock not to know, but we now are supposed to be wearing face coverings whenever we're out in public. And that is, I want to make a plug for the fact that when I wear a mask and when you wear a mask, we decrease the risk of transmission. It's a great way to protect ourselves and to protect each other. And you were mentioning the Mother Stroll. So in the past, we've always done it in person, and it's a lovely gathering of people. I love the fact that this is just what we're going to have to do. We're going to have, it's shifting to new ways of doing things. And so the fact that the need doesn't go away. We still need to connect. We still need to stay active and move our bodies. And we know that dancing and walking, those things are very protective. And if moms can do it 6 feet apart in the park, that is still in compliance with social distancing, and that's a great way to stay connected.
Yeah, so Holly and I hope that you'll join us. The event will be running from July 23rd, so today, all the way till August 8th. And it's also in honor of World Breastfeeding Week, which is always August 1st through the 7th, and we're extending it to the 8th because it's a Saturday. So I'll give you one extra day.
And can I talk for a minute about breastfeeding?
Absolutely, yeah.
So I want to mention breastfeeding. And again, I'm a lactation consultant. I love breastfeeding. It's magical. It's amazing. Breastfeeding for women, first off, breastfeeding is amazing for moms. It's amazing for babies. It's just phenomenal from a public health standpoint what breastfeeding does and what breast milk does. It is also the hormones in breastfeeding, when breastfeeding is going well, are protective. There's multiple studies that show that helps to decrease that abrupt drop in hormones in the postpartum period, so it helps to protect women's moods and helps to decrease anxiety. That's when it's going well. When women are struggling with breastfeeding, we see women having higher rates of depression and anxiety. And which came first, chicken or the egg, we don't know, but it makes sense, right? Because it's so vulnerable having your baby at your breast, and you want to be doing everything right, and you want to be feeding your baby, and the baby's crying. And so we have amazing lactation support services through Enloe. There are other lactation support services in the community. WIC has lactation support services. North Valley Indian Health has lactation support services. La Leche League, there's lactation support services out there. But I really want us to call that out for moms, that fed baby is best. My biggest thing for mamas is you are enough, you are doing the very best you can, and we all want to do our very best for our babies and for ourselves. And we want to make sure we're supporting mamas in that, but we also want to, there's so much pressure on women. And so just knowing that's it's a two-sided coin, and both of those are true realities. And so we want to support women in breastfeeding. We also want to make sure that women are well and that babies are well and that everyone's getting what they need. And again, support. Whatever women choose, and making sure people get what they need. Sorry, I talk with my hands.
No, it's great. It's so great. So for some. I just want to share. So Holly was one of my midwives for my children, and hearing these words again, they were the words she shared with me when I was going through my pregnancy and my births, and it's true. So I hope that you hear her words and feel comfort. And also know where you can go if you need help or resources, because they are available to you, and that we just care and want you to take care of yourselves. But
and I have kind of a specialty in perinatal mood and anxiety disorders, and so I have a busy practice, but we're happy. We have amazing doctors and nurses and midwives, and we're happy to help people. So please reach out to us. Don't be afraid. We are here for you, and we're going to walk through this whole pandemic fun time together.
We sure are. This has all been really great, Holly. I'm so grateful for you to be here and share all this great information for our moms out there and dads and spouses and anyone else who's out there, raising a family. Is there anything else you'd like to share before we sign off for today?
I would like to share that I think that motherhood is transformative, and that I think that when women give birth to a baby, we forget sometimes about the woman giving birth to the mother of herself, and that I just really want to tell all the mamas out there that we are all in this together, and we have each other, and what you're doing as a mom is so, so important. There's nothing more important.
Yeah. Thank you. So thanks everyone for joining us. Thank you, Holly, for being here. Please join us for our next Facebook discussion. And until then, feel free to sign up for our virtual mother stroll, which is going to be again July 23rd today, all the way till August 8th. And you can sign up on runsignup.com and search Enloe's virtual stroll. You can also find the link for the event at www.enloe.org/events. Take care for now. Thanks, you guys.